Dr. Mugdha, yes.
So, good morning everyone. Myself Dr. Mugdha Jain from ADK Jain Eye Hospital, Khekra. I shall be talking on magnitude of cataract in India, a review on it. So let's address the problem first. Cataracts are the leading cause of curable blindness worldwide, we know all that. According to the WHO, as of 2021, there are an estimated 2.2 billion individuals living with near or distant visual impairment. Approximately 1 billion people of them suffer from moderate or severe distance visual impairment, with almost 94 million diagnosed with cataracts. Cataracts are responsible for 45% of global blindness in 2020. But India was the first country to start a blindness control program in the world with the National Program for Control of Blindness and Visual Impairment in 1976. Program aimed to reduce blindness and visual impairment through various interventions, including medical treatments, surgeries, and awareness campaigns. According to National Blindness and Visual Impairment, NPCB-NVI survey 2015 to 2019, cataract contributes to 66.2% of blindness and 71.2% of visual impairment in the population above 50 years in India. But the demographic transition and improved healthcare access have led to a growing number of older adults in India. The older adult population is growing about 3 times higher than the overall population in India and is likely to be 20% of the population share by year 2050. And we know that the impact of cataract extends beyond visual impairment as it can significantly affect individuals' overall well-being, independence, and quality of life, imposing a substantial economic burden on individuals and society. WHO recently adopted the resolution on integrated people-centered eye care, IPEC, including preventable vision impairment and blindness, and within it proposed the development of feasible global targets for 2030. And where are we? So according to National Blind Visual Impairment Survey 2019, coverage for cataract surgery among blind individuals and visually impaired people was 93.2% and 74% in India respectively. But the good news is, under National Program for Control of Blindness and Visual Impairment, a mission mode cataract surgery campaign known as Netra Jyoti Abhiyan was launched to be between 2022 to 25 to clear backlog of eligible cataract cases by allotting yearly targets to each state and union territory. For the financial year 22 to 23, a target of 75 lakhs cataract surgery was kept, against which 83 lakhs cataract surgery were done. This drive is a major step taken to reduce the prevalence of avoidable blindness to 0.25% by 25. Similarly, the targets for 23 to 24 and 24 to 25 have been proposed. But future targets are WHO recommends a rise of 30% of effective cataract surgical coverage by 2030, which will make a higher target of 66.67% from the existing ECHC of 36.7% in India. To achieve that, we need to focus on activities that can enhance the quality of cataract surgical care and monitor the standards set by WHO. Thank you.
I have one question for you.
Yes, sir.
Am I audible? Okay, so the cataract itself is, we know the pathophysiology of the cataract, how it causes, and like we know everything about the treatment available. So why in India it's so difficult to eliminate the cataract? What do you think? What is the best answer?
Sir, the emerging causes are, first is we know that out of the many causes of cataract in India, the main is we have the older population which is rising. The first is that. Secondly, our climate, the tropical climate in which we live. Thirdly, the access to the surgical care and the amenities and the facilities we don't have. Fourthly, the economic facilities, the economic patients do not have so much of money to reach to the services. Because we see in our center also, there are so many people who are not willing to spend even a penny because they don't have it. So we are doing almost every day, we are doing camp surgeries, and so many of them. And we are so delighted to offer them surgical care. And sir already showed that we are giving good results also. So the reason is that whenever we ask them, suppose any investigation is required, apart from cataracts, then they are not willing to do it because actually they don't have money. So the access to the, and there are not many places, not many hospitals who are offering free surgical care. So I think these are the reasons why.
That aging population is one factor and a lack of infrastructures in the remote area. But you see, that now that surgical skills, so there's an issue in terms of surgical skills because in the latest National Blindness Survey, that post-operative, that cataract surgical outcome, we aim to have someone, get operated to have a vision 6/6, but the post-surgical complications, as Dr. Praveen,
Yes.
so it's second most common now. It's, not the second, third most common cause of visual impairment.
Yes, sir.
So we need
According
see
to the
surgical-
survey of 2015 to
So
19.
as he said, a surgical expectation, the patient expect to have a best vision acuity
Yes,
6/6
sir.
after surgery. So the trust and belief also now, the issue. Okay.
Yes,
Anyway, thank you.
Thank you, sir.